Good afternoon, everybody. My name is Dr. Jarrett Ross. I'm Chief of Staff at Lynn County Hospital District. We're making this video to just give you an update of what's going on here in our area and in our facilities regarding this COVID-19 virus. Now, I understand this is a rapidly changing thing. We're rapidly changing policies and procedures and adapting to what's going on a daily basis. But just to give you an update of what's going on, first of all, we'll talk about the virus itself. The virus has 3 confirmed cases in Lubbock as of last night. Now, we have been very judicious on our testing. We have recommended that people quarantine themselves at their home, and we have also done that at our facility. We have a separate clinic just for people that potentially have this virus. There are multiple patients we have at home self-quarantine that we did not test, and we have had some patients tested. Now, to clarify though, we at this time do not have any positive patients in Lynn County. Now, I expect that may and will change in the coming days or weeks, but at this time that's where we stand. We don't have any positive cases that we have tested here, nor do we have any people that we are concerned that may have the virus in our hospital. So that's where we stand right now. That may change, and we'll let you know in the future. Now let me tell you a little bit about our clinics and our hospital and what we've done and what we've done to adjust to this virus. Now, here at the Family Wellness Clinic in Tahoka, we have separated and isolated an area in our facility for the COVID-19 testing, and there's a separate area for all of the other clinic visits. We have made changes as of the past couple days to reschedule all of our regular follow-ups that do not need acute visits. We've rescheduled our annual examinations. We've also rescheduled well child visits. We occasionally are still seeing patients. We're all still here every day, all day, but we still are seeing patients as needed. What we do ask is that you call our clinic. We are doing our very best to decrease traffic by having patients call, and if we can treat that condition, we're going to treat it over the phone, so we're reducing your exposure to the community. If we need you to come in, we will absolutely do that. But as of right now, we're trying to do everything we possibly can to reduce exposure by treating things on the phone. If you have symptoms of cough, congestion, fever, exposure to someone who might have the virus, all of these symptoms, and that you're concerned you might have the virus, we have a clinic line for you to call for that, to make an appointment for someone to call you first, and if we think that you need to be tested or further evaluation, we will make an appointment for you to come into the clinic, the COVID-19 clinic, in order to test or further evaluate you. Now, we are going to do our very best to try to treat you over the phone. If we feel like you need to be evaluated, we'll bring you in. As far as the other clinics go, we have a clinic in O'Donnell. They do not have the virus set up like we do, but they are still there. They're going to answer your phone calls. They're going to treat you as they can. If they have concern for the virus, they will forward you to our facility here in Tahoka. Our other clinic is the Fast Track Clinic, which is connected to the hospital. They are also helping treat acute complaints and acute concerns. All of our clinics are going to do our best to treat you by phone first, but we are here and available for whenever you need us. Now to transition to the hospital side of things. Unfortunately, as you've seen in our prior announcements, to be absolutely very cautious, we've closed it down to the public. Okay, please communicate with our patients here by phone. If you have any questions, for sure, call us. Our emergency department is still open. We've actually started a screening process for the virus down at our emergency room as well. We have an outside area where when you come to our emergency room, no matter what, there will be a doorbell. We have our doors locked. As soon as you ring the doorbell, you will be asked screening questions. If you need to be seen for something that is not related to this virus, we bring you right in and we treat you appropriately at that time. If you have concerns about this virus, we will do a very similar screening process, use the personal protective equipment, and we will see you in our outdoor area if you do not have significant respiratory distress. If you have significant respiratory distress, we will bring you into our facility. Granted, our whole goal in all of this is to make sure our patients are taken care of, but also to do everything we can to prevent the spread of this disease. We are going to be here to help you. We are here to support you. We're here to take care of the people of this community, and we are going to make sure that we do everything in our power to do that. We are still short on swabs for testing here. We have a limited number. So right now we're testing only the people who meet the criteria by the Texas Health Department. Now there is a possibility in the coming days to weeks that we may be able to expedite testing in Lubbock, or even there's a small possibility that we may be able to bring testing into our facility. As we have those updates, we'll let you know, but as of this time, we don't. So that kind of shifts my conversation to what we ask of you. We're going to do everything, and we will be here to take care of our community. What we need you to do, especially with us having cases in the area, we have seen people who have been exposed to people who may have the virus in our area. All right, so in all likelihood it probably is in our area. This is not a time to freak out, okay? This is a time to do your role in preventing spread, and what I ask you to do is stay at home if at all possible. If you can work from home, please do. If you are a child on spring break, or you're a parent of a child on spring break, and spring break might be extended, and your child may have a long break. That child is going to want to go play with friends, want to go to the movies, want to go to Lubbock, all these type of things. I beg you not to. I beg you to stay at home, use this time to play board games in the house, to play outside, but at the same time to limit exposure to the general population. I think it's going to be it's going to boil down to that, to see how bad this disease is going to affect us. And so I really ask you to do your part to reduce the spread of this disease. We will be here at our clinics here at the Family Wellness Clinic in Tahoka, at the Fast Track Clinic, at the O'Donnell Clinic, and at the hospital here at Lynn County Hospital District. So if you have any questions, let us know. We, in the description of this, we will put the phone numbers that are appropriate to contact us if you have any concerns, and give us a call, and we will do our best to help you. Thank you.